Good morning, everyone. Being diagnosed with a disease is scary, but when we're talking about a child, it adds a whole new layer of worry. What are the key aspects of the diagnosis and management of juvenile diabetes? And what role does gestational diabetes play in causing diabetes in children? Answering all of your questions in the live session today is Apollo's Senior Consultant Diabetes and Endocrinology, Dr. Tirthankar Chaudhury. He's got over 24 years of experience and he will be sharing some expert tips with us to help us prevent diabetes in children and teens. So do not miss out on today's special episode of the Health Hour series. See you guys at 11 a.m. on Apollo 24/7's Facebook page and YouTube channel. Join us with your friends and family. Ask all of your questions live. The link is given below.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste and a very warm welcome to all of you. I'm super excited to be a part of this one-of-a-kind live health hour show, which has helped so many of our viewers connect with leading Apollo experts even during the most difficult times. Through this health hour, Apollo 24/7 aims to bring the best doctors from Apollo Hospital to your homes every Sunday so you can discuss your health concerns and get answers to all of your questions, health-related queries live. And if you want to avail the entire range of services by Apollo Hospitals from the comfort of your home, I strongly urge you to download the Apollo 24/7 app. Here you can book virtual consultations with the best Apollo doctors, order your medicines online, and even get home sample collection for your lab tests, all with Basic Tap. Let me also tell you about this wonderful initiative, Saving a Child's Health, Sachi by Apollo Foundation, that aims to provide the best pediatric care to children in need at no cost. So if you wish to know more about it, Do check the link in the description box or scan the QR code on the screen. Coming back to the show. Today we are here to discuss a very important topic, diabetes. Why are youth at risk? I'm sure all of us have many questions like what are the warning signs of rising wave of diabetes in teens? How to snack if you have diabetes, and why is diabetes on a rise in young adults? To answer all of this and more, we have Dr. Tirthankar Chaudhury, Senior Consultant Diabetes and Endocrinology at Apollo Multispeciality Hospitals, Kolkata, here with us today. So start typing your questions and we'll take them up with Dr. Chaudhury one by one during the course of the show. And yes, watch out for that quiz right after the live Q&A, where you can win exciting gifts, discount vouchers, and more. Dr. Chaudhury, he has over 24 years of experience in treatment of diabetes in children and insulin treatment. Received the postgraduate certificate in diabetes from London. President Kolkata Diabetes and Endocrinology Forum. Examiner MRCP UK. Reviewer Diabetic Medicine Journal UK. Dr. Chaudhury, please, a very, very warm welcome to you. Thank you for joining us today on our show. Wonderful to have you here with us today.
Namaste and good morning.
Namaste and good morning to you as well. Doctor, please tell me, diabetic is taken an epidemic proportion. How is it possible, or is it actually really possible to prevent developing diabetes?
I think this is one of the most burning questions that we have. If you look at the number of patients that we have on diabetes in India, it is about 73 million approximately. And probably there are many more who are undiagnosed. If you look at the global prevalence, it is around 423 million. So obviously it is in epidemic proportion. Now the question is, can we do something about this? I think what has changed over the years is the way we eat, the way we entertain ourselves, or in short, the way we live. It is possible to prevent this epidemic or at least reduce the epidemic if we try to get lifestyle intervention. What I'm trying to say, if you take even our generation 20, 30 years back and the way we used to live, we do not do that much physical activity nowadays. So if a lot of cycling was done and walking was done. And the other point is that a lot of processed food, because you know that fat is tasty for the palate. Therefore, whatever processed food or food you get from on your doorstep is tasty, but they're very high calorie stuff. So what is happening? We are consuming more and spending less. So we are gaining weight effectively. On the top of that, we South Asians are genetically predisposed slightly more than our Caucasian partners to diabetes. Therefore, if you want to prevent diabetes, it is not a very big thing as it sounds like. What you have to do have a healthy lifestyle, which is desirable for everybody. And that is desirable not only for diabetes from cardiovascular standpoint as well. What we need to do is have healthy food. I'm not trying to restrict you from enjoying yourself once a week or once in 10 days. What I'm trying to say, have a healthy diet and do a lot of walking. That is our body. As you breathe, our muscles and body needs also physical activity. So
Right.
it is very important that we do physical activity, and that would at least prevent or postpone diabetes for sure. Overnutrition is not desirable. Thank you.
Correct. So basically, you're talking about lifestyle change is what we need to prevent diabetes, basically. But a lot of young people are developing diabetes these days. What do you think is the reason behind that? And how can we prevent the young people from getting diabetes?
Yeah, I keep saying this that if you went to a school about get 30 years ago, you would probably get one or two obese child. But if you go to the school gate
Yes.
of any school today, you will find 30 to 40% that you want to bracket them as obese or higher BMI at least. The reason is one is I always say is misplaced priority on academics. We think that it started on our generation that we thought that if you only study, then you are a good boy, nothing else is good, which is wrong. So I think what is important is that as a society, we have to be more conscious. The children should be allowed to have sports in their school and encouraged for physical activity. It is also very important that in the long
Mm-hmm.
hours in school, they should be served hot lunch. They should not be given processed food, fries and chips and fizzy drinks and all this. So they should not have access to these. They should be educated about diet and lifestyle. Lot to go about home also. Food is a habit. I keep saying that at your home, if you have lots of colorful fruits on the table and vegetables and things, and right from the beginning you practice healthy diet, then your children will develop a healthy lifestyle. If you and nowadays, as
Correct.
you know, that both parents are working, and there is a problem about how to do it. But even then, you can actually channelize the food habit of the family into a healthier habit. If you fruits are very colorful and very desirable, if you put them on the
Yes.
table and you keep eating, I think the children will pick on it. They may not like exactly the fruit you take,
100%.
but they will get into something. So I think that the children are not getting one enough exercise or physical activity. They have got access to overnutrition, which is as bad as malnutrition. And second, misplaced priority of putting them on a stress about the academics, which is slowly changing again. But I think their playtime is often used
Right.
for tuition. I think these are a conscious decision that the family and the schools have to make,
Right.
and the society as a whole. Thank you.
I really like what you said. Overnutrition is as bad as malnutrition. And I think we're not realizing it. We're just putting so much food into our bodies these days. And I think which is why leads, along with no exercise, etc., which is what leads to this. But there's one question that I've been burning to ask you, and I've been doing research myself on this, is it possible to reverse a diabetes?
This is a very good question because the layman's press is with a lot of reports on this. And I'll tell you that this stems from few of the studies that have been done recently or some time back. One is called counterpoint study, one is called look ahead study, and one is called a direct study. Now, what they wanted to show is that by calorie restriction, can you reverse diabetes? Now, let me tell one, two, three things about this. Reversal has a bad connotation. It means cure, which should not be transferred to the patient. Then they will leave their tablets and treatment. Remission is a better word. Now,
Correct.
what we have found out is that remission of diabetes happens on early days of diabetes, means maybe in the first 3, 4, 5 years. If you try to do remission on a diabetic after 20 years of diabetic, then the insulin reserve decreases in the pancreas, and that may not be a good idea to do, and patient will not get that. Second is that calorie restriction has been established as a tool for remission. If you can reduce, as I was telling,
Oh,
that if you look at the First World War, when the food was scarce, the diabetes prevalence reduced by 50%. So, what I'm trying to say,
wow.
bariatric surgery is one of them, in which you actually not only cut down calories, there is also an endocrine. What I mean is the gut and the hormonal interaction that leads to the remission.
Right.
Direct study, as I was saying, was tried in the primary care. What I mean is the common clinics. And what they did is they gave a 800 kilocalorie liquid, semi-liquid diet with fibers and with behavioral therapy and physiotherapy and etc. They wanted to see in England in primary
Uh-huh.
care whether they can remit diabetes. There is a remission. It was found that it can happen in a limited number
Mm-hmm.
early on in diabetes, but very difficult to continue that diet, what's called Cambridge diet, 800. What I would suggest is don't do
Correct.
so drastic. What I would do is that make a reasonable, get a calorie assessment from your dietitian, try to undercut slightly to reduce
Right.
weight, and do not take too much anxiety with this because your happy hormones are important. If you are relaxed and
Yes.
think positively about diet and this disease, then you will be fine. And it's possible to some extent do remission that may be permanent, temporary, or partial. Thank you.
Wow, that's wonderful, doctor. Like you said, happy hormones are definitely important, but there is a lot of anxiety with diagnosis of diabetes, especially with potential complications. How do we prevent those complications?
Two things are very important that you have raised. One is about anxiety, and the second is about prevention of complication. Everything that we do in diabetes is to prevent complication. Because when the diabetes is not so bad, patients do not feel any difference. They are asymptomatic, and that is the challenge in treatment. If you had a chest pain, if the blood sugar goes up, then it would have been much easier to treat. The point is you do not feel any problem, and that slowly, it is the milieu, it is the atmosphere in which your organs live. And now if you give them a higher sugar level, then they have problem in steroids, so
Right.
they affect the kidneys and the heart and nerves, etc. So it is very important that we treat in a way that we give the diabetes treatment to keep the blood sugar under control. We make sure the cholesterol is okay. We make sure that the blood pressure is normal. We make sure that the vitamins are adequate in the body. So these are done to prevent complications. And it has been seen that if you can keep your blood sugar under control, then your complications reduce by 33% or even more as the time goes, even by 1% reduction of your
Right.
HbA1c. Other part is anxiety. I think one of the problem is that we time or whatever, we do not handle this part most commonly. I'm not saying everybody handle this part of the diabetes treatment very
Correct.
well. Remember, a patient who is younger by 10 years in comparison to the Caucasian comes with a lot of anxiety when they're diagnosed diabetes because they are the earning member in the family. So anxiety should be addressed with reassurance and with scientific reassurance, knowledgeable assurance. This is not that a blanket saying you'll be fine. If the patient can understand what you are trying to do and what diabetes can do, I think they are better treated and has got a better outcome. Thank you.
Right. So, what about children with diabetes? Do you have any advice for them for proper diabetic care?
There are two kinds of diabetes that's happening to the children at the moment. One is, as we know, is type 1 or juvenile diabetes that you know. And there, the treatment is
Hmm.
insulin and insulin. Tablets have no role except acarbose or something. So primarily, they're a different group. And what we are finding with increased obesity and with the changing lifestyle, we are getting young people developing adult-like type 2 diabetes. That is my worry very much
Oh,
because these constitute 95% of the diabetic patients. So if children start getting diabetes in young age, I'm getting even class 8, 9, 10 standard student of diabetes who are having diabetes of adult type. I think that is a very frightening thing, and we must try to
yes.
do the diet and the lifestyle. And as a society, we have to take some responsibility regarding how the children eat and how active they are. What physical? I can remember in when it may sound just very more relevant because when I was in school, I remember that every day there was a games period, sports period for 45 minutes. And if I am not participating in that,
Yes.
we have to get a letter from home that I am not doing the sports today. But when my son went to the school, he
Right.
used to have a sports day only once a week. And that once a week, he used to be on a tracksuit. So it was more of uh,
Yeah.
show or more of a visibility of
Show off.
sports rather
Exactly.
than actual activity. I think that has to be taken into consideration. So if we can bring that back, and as the
Yeah.
first part, we did many initiatives. I myself was involved in kids project of IDF, where we are talking prevention of diabetes and taking care of diabetes in children. So we got 200 schools in Calcutta, and at least 20, 30 have written to me that they have stopped the processed food in their canteen. I think that is some initiative that can do good. And every children or every child who is having diabetes or any other illness should inform to the school. Don't hide it. Remember, you are protecting your child.
Right.
What
Of
happens, you
course.
don't want to tell the school. You think that if you tell that your child has diabetes or something to the school authorities, others will know that is not something too good. But it is not.
Right.
If you let the authorities know, they will be able to take care of your child. So it is very important
Mm-hmm.
that schools should
Correct.
know if your child has a diabetes. That can prevent hypoglycemia emergencies, etc. Thank you.
I think that's a wonderful idea, though. Like you said, 20, 30 schools in Kolkata have already started, have deleted processed food out of there. I think it sort of needs to be made mandatory across board because this is not just a singular problem. This is a social problem, like we said, at an epidemic
Absolutely.
level. But tell me, doctor, is there any ideal plan for managing diabetes?
Yes, it is a good question because remember that most of the concept that people have is that if you have diabetes, you go to a doctor, sorry, and the doctor writes a prescription, and that is the plan of diabetes care. And I was saying just some time back that we tend to be restrictive and prescriptive. What I mean is that we give a prescription,
Mhm.
you have to take this medicine, and we are restrictive that you don't eat, don't do this, don't eat this, and that does not give a good outcome on diabetes. What is important in ideal prescription
Okay.
that patients should be part of the care. So what I'm trying to say, do not underestimate the understanding or wisdom of your patient. You may have to
Mm.
need to go down to a layman's language. But if you tell the patient that what you are trying to achieve and what will keep him well, I am sure that outcome is going to be much, much more better. So the ideal plan would be education, treatment for diabetes, prevention of complication, and get the dietitian on board and also screening for complications. So what I'm trying to say in nutshell in this
Correct.
program, that it is a holistic approach to a patient and do not be just prescriptive and restrictive. That saves time but does not achieve the purpose. Thank you.
Absolutely. Lovely, doctor. Okay, so now I have so many questions already coming in. Ms. Vaishnavi asks, is intermittent fasting good for diabetes? Now, this is a lot that I've been hearing all over the place, and now intermittent fasting is the thing that everybody's been doing across this country and everywhere else in the world as well. So, does that help in any way?
This is the scientific term of calorie restriction, as I was saying. So this is, of course,
Right.
good. But
IF.
when we are saying that this is good, remember, suppose the patient is or the person is on insulin or tablets, and suddenly one fine morning you take all your tablets and insulin and don't take your food, that is going to be a catastrophe because you are going to get severe hypoglycemia. So, your intermittent fasting plan for non diabetics is very good to prevent it or keep a good health. For those who have developed, needs to discuss with your doctor that I want to do 2 days of intermittent fasting, and that can be partial, not that you are doing 24 hours, and which meal you are going to skip. Then we can, if you are on insulin
Correct.
and if you are on tablet, we can reorient them. Remember, some of the drugs in diabetes do not, for all practical purposes, cause hypoglycemia, sugar down. And some of the tablets just prevent sugar from going up. So if you are doing intermittent fasting, it would be advisable to give you tablets that doesn't cause hypoglycemia, but do not let it go up. But if you are using tablets and insulin, that causes sugar to go down and you are on a fasting, then it will not. So an educated intermittent fasting is what I am suggesting. Thank you.
Wow, that's lovely, actually. Um, okay, doctor. The next question is from Mr. Utpal. The patient age is 28, gender female, who's suffering from type 1 diabetes. How to plan pregnancy while having diabetes?
Well, there are one or two things I want to say, and that is first is pre-pregnancy counseling is very important. I can pride myself saying that I worked in one of the biggest pregnancy diabetes clinics in the world in UK. So that's for your reassurance. But what I can tell you is that you should plan pregnancy. What I mean is pre-pregnancy counseling. You should not enter pregnancy and then come to the doctor saying, I've got 300 sugar, what to do? The reason is that the first 12 weeks are very
Right.
crucial for the mother and the baby, more for the baby in terms of uh, organogenesis or organ development. So if you have gone into that and the pregnancy is diagnosed in 6 to 8 weeks and you have been harboring a sugar of 300 level, then you might have done irreparable damage. Therefore, it is possible,
Oh,
very much possible to have a good outcome in pregnancy in diabetes. What you need to do is you should remember you should consult your doctor, have a pre-pregnancy counseling. You should be on intensive insulin regimen, and that can also our targets are also very intensive. You need to be educated about that, and we can use only very one tablet probably metformin, and you can use insulin that is even to given 3 4 times. Don't get scared. If you are given more number of insulin, do not get scared. It is only for better outcome during the pregnancy. And remember, even nowadays, there are a lot of studies on insulin pump and pregnancy for the patient who have got brittle diabetes and type 1 diabetes who are not coming under control. We even use an insulin pump. But basal bolus, that is 3 times pre-meal insulin or even 4 times with a basal, also achieves maximally in maximum number of patients a good outcome. We will also have to keep an eye on the eyes during pregnancy. In diabetes, we have to eyes on the kidneys because the eyes can deteriorate in pregnancy.
Right.
So we have to be very planned, aggressive, and educated management, and you can have a very successful and good outcome with type 1 diabetes with pregnancy. Thank you.
That's wonderful to know. So I think, yeah, you of course you can have a absolutely amazing pregnancy. Just follow everything that the doctors just told us. The next question is from Mr. Abrar Sharif. Do we get diabetes and blood pressure as post complications of COVID-19?
That is a very educated question to ask. I think the first is that let's come to the diabetes. We know that diabetes and COVID is bidirectional. What I'm trying to say is diabetes worsens COVID and COVID worsens diabetes. There are a lot of, we are not very long into the history of COVID 19, remember. We are just 1 year or so, just crossed 1 year. So,
Right.
not that I can claim that we know everything about diabetes and COVID, but we know something, or we may know something more than just less. So, what we think is that diabetes and COVID can come together and it can make worse the existing diabetes, or it can also cause new onset diabetes. But in long term, whether that will continue is still we are yet to know, because most of them get resolved. Now
Right.
that gets also camouflaged by the fact that a lot of people have impaired glucose tolerance and they're manifested in diabetes, and we try to say that COVID did it. Now COVID can also have steroids that can bring up sugar. So there are multiple issues about that, but it is bidirectional that we know. Hypertension is a different thing. Hypertension can coexist, but the fact that this causing that is difficult to establish yet in the parlance of science. But what we can say that hypertension may coexist in vast majority, and it is a vascular disease. You know, diabetes is a vascular disease.
Correct.
So the heart, the blood pressure, and the kidneys and the eyes, they may be interrelated. So you have to prevent complication, and please follow a doctor's advice and do not get anxious about the complications of
Right.
diabetes. If you cooperate, you should be fine. Thank you.
Absolutely. So our next question is from Mr. Sean David. Doctors prescribe tablets containing metformin, which is stated to be harmful to kidneys, as per many theories, and some doctors also say that. Why so?
I think this would be very uh, sweeping statement to do, because metformin is
Mm,
the first line of treatment in diabetes. There are some
right.
contraindications where you don't use them, and that are very rare and far in between. If your doctor says use metformin, please do understand that this is the first line of treatment in diabetes, especially type 2 diabetes. I mean, in the diabetes that we see 95, 96% of patients. So, therefore, metformin is a very good drug
Right.
and it is used in vast majority. There was some anxiety some time back about lactic acidosis, but that is a different clinical condition, very rare, and doctor knows when not to use it. Second is about the kidneys. No, metformin doesn't impair kidneys. When the kidney is impaired, we use selectively metformin. So it is not that metformin is destroying your
Right.
kidney, but if somebody has a renal impairment, we use it cleverly and wisely in patients of renal failure. Thank you.
Right. Well, I hope that answered your question, Mr. David. The next question is from Ms. Subha Nair. Who should do a bariatric surgery? Is there any specific age or condition when one should consider undergoing this surgery?
I think the indications for bariatric surgery are laid open in the press. You know very well that if your BMI is over 40, if you have got 35 and comorbidities, you can do a bariatric surgery. Bariatric surgery are also
Right.
2 times that for all practical purposes. One is gastric sleeve resection, and one is gastric RNY gastric bypass, which means that your stomach is thrown out and you have connected the other way around. and the other is your stomach is there, and you only take out a piece of it, make the
Stitches.
stomach very small. So, who will take
Got it.
it? Is not a decision that is given as a sweeping statement. That decision has to depend because it's a traumatic surgery, it is a big surgery, it needs lifelong
Right.
supplementation of other things. So, decision has to be taken between the patient, the doctor, in a skillful way with the support of the dietitian and the whole physiotherapy and behavioral therapy. But yes, who can do it? Anybody on that age group can do it. And the remission rate at 5 years of RNY gastric bypass is about 45 to 50%. What I'm trying to say is that in 5 years' time post gastric bypass, your remission of diabetes has been found to be almost in half of the patient that has been done. If you go in a gastric sleeve resection at the 5 year time, it is a smaller surgery. So it has been found to be around 29 to 30% patient has been able to go remission diabetes, early in diabetes with morbid obesity. In the people who have got a direct study or calorie restriction studies, you are not at that level, something around 10 to 12% patient remaining in remission in early diabetes with calorie restriction at 5 years' time. Choice is yours. Thank you.
Oh, how lovely. Okay, doctor, here's a question from Advocate Nameen Hussain Qureshi. Sir, my daughter, aged 9 years, is suffering from type 1 diabetes from last year, and she's been taking insulin daily, but her diabetes is not controlled. Please suggest what we can do.
Yes, I think type 1 diabetes is a special area of our expertise, and it is possible to keep type 1 children with diabetes well. Now, I know it is a more challenge for even the doctor as well as the family and the patient to maintain sugar because they are young, they're children, and they will try to do this and that. Now, we go up the step ladder for insulin. So the minimum that the patient should be taking is one short acting insulin before meals and one basal insulin. What we are trying to do is mimic the physiology, the way it happens in our body. We have got continuously a background insulin and we have got an insulin spike whenever we are eating. Therefore, the purpose is to give insulin in a way that the child is taking some insulin before he eats. Lot of behavioral and positive thoughts and discussions is important. And then we give a background insulin. If you think with this basal bolus regimen that you are giving insulin before food, and it gives flexibility. Suppose the patient is not eating, then you can skip the bolus. So I think this way patient remains good, but there are a lot of patients who are on insulin pump, and I think that every type 1 diabetic patient should be given the option of insulin pump. Now you may say it's expensive and think that is true. I totally accept. But what I think is that the choice should be given to everybody. Because you have raised the topic of a child with diabetes, I think it may be very encouraging for you to give an anecdote. I have got a patient who was a child and whom I told she's on insulin pump and she started off in class 7 and now in college doing very well. Now let me tell that when she came to me, I told them that you are on an insulin pump. So suppose you are taking as a basal 1 unit per hour, and then we give something 3 4 before your meals. Then you can keep checking your sugar that is visible also real time, and you can manage your sugar. And I'll tell you the very interesting part once they get educated. You know, the child came back to me after 3 4 months and said that Dr. Uncle, you told me that I should take before my meal 4 units in the evening. Now, when I go to a birthday party, I take my starter, I take my cold drinks, I take my main course, I took my dessert. I eat for 3 hours. So, what is the time and what is my bolus? So, I told, then what did you do? And what the child told me is that you have told me a basal of 2 units per hour. So, what I did, instead of giving the basal, my basal was 4 units. So I increased my basal, that 2 units going ongoing. I made it 4 or 5 units, continued it for 3 hours, got back to the basal. Sugar was perfect. See, if
Wow.
your patient and the family understands what exactly I'm trying to do, that is possible to manage. That
Right.
was perfect. What they did is raise the insulin level for 2 3 hours as long as the
Right.
uh, intake was going, and then came down.
Child was, yeah,
to the basal. So the sugar was okay. So I think these are small, small things you learn as you do. So I think it is.
correct.
There is nothing to be scared. Option of insulin pump should be given. Basal pump. It is very important the
Mm,
family becomes a part of the education, and if that is done, it is possible to have a
mm,
good and healthy lifestyle. I don't want to name the Olympians and others who are on basal bolus type 1 diabetics, and they have been diagnosed even in children. It may be not be inappropriate for my knowledge of the patient, but they are Olympians. They are going to the
correct.
Everest, and they are on type 1 diabetes. Don't worry.
Right. So the next question is from Mr. Sarkar. What is the sugar level above which I should consult an endocrinologist?
This is a good question. I think that if you have got diabetes, you must see a diabetes specialist because the target, if you want me to put a thumb rule, then I want your HbA1c to be less than
Mm,
7%. But let me tell you that decreases in pregnancy diabetes. In children, and healthy young
mm,
adults, my target is 6.5. If you go up again in elderly patient living alone, my control may go up to 8% or even 8.5%. Somebody who is 80 above and in a
mm.
home living alone, my target is 8.5% or even 8%. If somebody who is young and healthy, my target is 6.5%. But as a thumb rule, 7% and below is my HbA1c target. And when do you want to see a doctor? Choice is yours. I don't want to force you, but I think it is wise that you consult a diabetes doctor, not only for the sugar, but the prevention of complications. Thank you.
Awesome. Also, doctors, somebody's been asking many times, is exercise, diet, stress enough to prevent diabetes? Mr. Anas Ansari wants to know.
Well, I would take this question in a reverse way. Let's go 40 years back.
Yes,
What was the prevalence of diabetes in this country? And what is the prevalence now and what it is projected to be? So why is that change?
correct.
Just because the lifestyle has changed. So if you do exercise, you have a genetic predisposition that I am not denying. But if you try to do exercise, if you do your calorie restriction, or I say healthy diet, and then it will be possible in 50% of the patient to get down. Now, an example is very good. If you look at the Pima Indians, in the highlands of Mexico, there is a tribe. They are called Pima Indians.
Correct.
They had no diabetes. Pima Indians in the highlands of Mexico. Now, when they part of their population shifted to Arizona in US, they were overfed and they became all obese. And you know what was the diabetes prevalence in Pima Indians in Arizona? 1 in 2. So 50% of the people
Wow.
of the Pima Indians in Arizona were diabetic. And when you go to the highlands, they were non obese and they were non diabetic. So it was the genetic predisposition that was the primary culprit, and the acquired lifestyle because of their calorie restriction and physical
Right.
activity. So that answers your question what physical activity and healthy diet can do to you. Thank you.
I think the more I hear you, the more I think that food that we eat basically is either medicine or then it just puts us down the drain to cause all of these illnesses, including diabetes, which can then cause so many complications and other issues as well. So, food and lifestyle changes are basically the thing to do if you want to maintain and just stay healthy for and get through your life without all of these complications, isn't it?
Food is important, but what I'm
Um,
trying to say is a healthy food, healthy diet. It is just that
Healthy
the
food,
direction
yes.
that where you should quantity and quality in food is very, very important. Quantity and quality. So what you are eating, how much you are eating is very, very important. And the problem is we cannot straight away find the calorie content, and the other is glycemic index. When you say the quality, what I'm
Yes,
meaning is
yes.
often people ask कि which one is good, कौन ज़्यादा अच्छा है, चावल या रोटी? Your diet is rice is good, a diabetic or a chapati. So the concept of glycemic index is that when you are eating 100 grams of rice and 100 grams of chapati, the rise in the sugar value is more sharp with rice and with rasgulla. I mean the mithai. But if you get a chapati, it is more flat. So it is the lower glycemic index that I'm insisting on. Lower
Especially.
glycemic index means that the calorie is same, but the absorption is more flat. So the sugar doesn't have a spike.
Correct.
Same as fruit. Some people come and tell me that which
Huh.
fruits I should not take. Remember, fruits can be divided into group A and group B. B group fruits are those 100 calories have got 90 calories to 120 calories per 100 gram. A group is 60 to 90. So those who are 60 to 90 are better because they've got lower calorie, less calorie, and probably less glycemic index in comparison to the more higher ones. Now, like apple, mosambi, santra, peach, other these fruits that we kharbuja and melons and
Correct.
all, they are better. But whereas mangoes, lychees, and
Better.
grapes, they have got it. Now, another
Bananas.
question is about watermelon. You keep asking about watermelon. Watermelon has a high glycemic index, means it is rapidly absorbed, but the calorie load is very less. If you look at cucumber,
Less.
it has got
Correct.
15 calories or 12 calories per 100 gram. If you look at watermelon, it has got 15 to 20 calories. So why say no? But the difference is it has got 94% water or 95% water. But the amount of watermelon intake it sharply contributes to the sugar. So watermelon is not a no-go position. You can take watermelon in restriction because it has got very small calories. So we have to understand the calorie load and the glycemic index, the quantity and quality of the food you are taking. Thank you.
Absolutely. I'm so glad you touched upon that, doctor, because we had a lot of questions asking about whether I should eat rice and why fruits and things are sort of given a bad name when it comes to diabetes, including my father, who's a diabetic as well, who sort of say, okay, I'm going to stay away from fruit. I can't eat fruit. But yeah, thank you so much for answering that for me as well. So the next question is from Mr. Chakrapani Reddy Konde. Will diabetes affect male infertility like sperm count and morphology?
Well, what I would say is that it has more to do with importance thing rather than because I told you at the beginning that is a vascular disease. Therefore, what is going to cause more commonly is erectile dysfunction, and that is an indication of vascular involvement. Remember, if you have got high albumin creatinine ratio or protein coming through the urine, that is the first sign you are thinking that the vascular tree is affected. So, if you have got a high albumin creatinine ratio, we have got drugs that we treat and they have shown to be beneficial in patients. Now, this vascular tree is important in erectile dysfunction. So, yes, we have got a treatment, but diabetes can, I'm not so worried about sperm count, and that may have a lot of other things involved, including infection or involvement of your testicular organs or the genital organs and things like that, but orchitis and inflammation and so many things. But I think the diabetes related issue that we are trying to talk is erectile dysfunction. And therefore, glycemic control and taking care of complications can keep you off this complication that I have been talking out from the beginning. That to prevent complication, you need to see a doctor. One question was there. He asked about when to go to a doctor. I was saying it is not about the blood sugar that you drive to a doctor, and that is in a vast majority of cases. We see patients because the blood sugar is high. But what we don't see is that it is not the blood sugar alone for which you should see a doctor. We should see a doctor for prevention of complication. Once the complication sets in, then it becomes a more different thing than just diabetes. Therefore, my thoughts to you is that it is the erectile dysfunction that you should worry more, and you should consult your doctor early on because you may have associated problem and they may need independent evaluation and management. Thank you.
So the next question, doctor, is from Mr. Anand Dhanwani. I am type 2 and insulin dependent. Why insulin doses are in fixed mode? It should have variable units depending on the kind of diet we take.
Yeah, I think the term insulin dependent, I would change it to insulin requiring because that was the previous classification, the way we used to talk. But that gives a connotation of type 1 diabetes, where you don't have any insulin and you are insulin dependent. I would say you are type 2 diabetes insulin requiring. That is number one. Number two, of course, if you must have noticed that nobody is on a strict insulin dose. We need to adjust it depending on what insulin you are. Suppose you are on once a day basal insulin. Then we check your fasting sugar and aim to keep it between 80 to 126, or you can say 90 to 130 more leniently. If you are on twice daily, then we check your fasting and before dinner. And obviously, your diet has to do, because if you go to a doctor to show your fasting
Correct.
and PP sugar, and before your postprandial, if you take four sweets, your PP will be high, but at home it may not be. So it is very important to do your test with a normal lifestyle, normal diet. And if you are on a particular pattern of diet, that will also dictate, along with your disease, how much insulin you should take. And that is not a fixed thing, that should fluctuate. It is also important to take small amount of food. Don't give long gaps if you are on insulin. Distribute your calories with discussion with the dietitian. Take your breakfast line. We say 3 meals and 2 snacks. So you can distribute your calories, and then don't give long gaps. Sometimes people, what they do is that take insulin,
Mm.
take their 10 o'clock meal to go to the office, and then don't eat it for till 3, 4 o'clock. Now, if I try to adjust the insulin dose, considering your 4 o'clock sugar, then your sugar will be high when you are
Mm.
eating. And if I give my
Correct.
insulin on the time when you are eating, then you will be hypo by the time at 4 o'clock. An interesting thing, just to tell you in this
Mm.
context, is in Mizoram and the Northeast, I see a lot of patients, they take two big meals, one at 10 o'clock, one at 6 o'clock. Now, if you want to give them insulin, you start wondering. They start something very easy in the middle, very small snacks. So, two big meals. Now, how do you plan your insulin regimen in this patient? So it is very important to understand that, and I leave it to the experts to decide what to do. There is a lot of education also on food, as you said, that what you eat, and we calibrate our, and we decide and titrations, etc., and the insulin depending on what you eat also. Thank you.
Absolutely. So my next question, doctor, is from Ms. Shanti M. Doctor, I'm diabetic patient for the past 7 years now. Now thyroid problems are there and my sugar level has been increasing. I think what she wants to ask is whether I go for surgery.
Surgery for thyroid or sugar? What surgery? Tell me again the question,
I
please.
probably means the I'm diabetic patient for the past 7 years. Now thyroid problems are there. My sugar levels have been increasing wherever whether I should go for surgery. I think probably the
Okay.
bariatric surgery is what she
Yeah,
might be talking about
I
because
will
that's what we
handle
spoke as
both
well.
of them. I understand. You are correct. It may be bariatric surgery you are talking about. As I said in the beginning, that if it is due to thyroid, then of course it has to be nodular thyroid and something else. If you are talking of diabetes and surgery, then of course the bariatric surgery include restrictive surgeries, or you can have, as I said, a gastric bypass, a gastric sleeve resection, or you can have Roe and Y gastric bypass surgery. But the indications are very clear. You should be very obese. I don't want to use the term morbidly obese.
Mm,
That is not, that has got bad connotation. If you are overweight, BMI is 40 or above, or if you have got
correct.
comorbidities and 35, then discuss it. What I mean by comorbidities is you have got associated COPD, obstructive sleep apnea, and other things. So discuss with your doctor. You must know everything about that surgery, that what happens after surgery, the amount of food you will eat, the calories that lifelong, and the vitamins that you need to take, and the benefit that you may get out of the surgery. You need to have a heart to heart talk with your surgeon, understand everything, and there is no thumb rule that if you are 7 years in diabetes, go and have the surgery. Not at all. I've got 20 years diabetes, 25 years diabetes. We are not asking them to go for surgery. So it will be a combined decision between you and the experts and the doctors, and then you decide that whether you need to be taken. If you are 110 kg, 7 years diabetic, and you are early onset in diabetes, say last 5 years, I think surgery would be a good choice. But
Mm.
you need to discuss them in context. Thank you.
Thank you. I hope that answered your question, ma'am. So the next question is from Mr. Devarsi Negi. Sir, what time one should take insulin and stop medicine? Can we take only medicine forever? Is there any side effect of diabetic medicine?
There are two things. One is type 1 diabetes do not have an insulin reserve. So you have to be on insulin. The question of tablets doesn't come other than alpha glucosidase inhibitor that you can leave to the doctors. So if you're type 1 diabetes, it is insulin. For type 2 diabetes, the reason we use tablet is because there is a residual insulin left in your body, number one. Number two, there are tablets now available in the market, very, very important tablets that not only takes care of your blood sugar, it reduces your weight, it takes care of your heart and kidney. It prevents the complication of your heart and kidney. So if you are thinking that either I take this or that, it has to be taken appropriately in your context. Remember, there are very exciting drugs. We call them, just if you are very computer savvy or tech savvy, like GLP-1 RAs and SGLT2 inhibitors. We know that these molecules have shown independent benefit in protecting and preventing cardiovascular complication and renal complication. SGLT2 inhibitors have shown benefit in metabolic cardiorenal complications. Therefore, do not have such mindset that I take either insulin or tablet. What we do is that appropriately we prescribe. It is not only just about sugar. We need to get your glycemic control, number one, and then we need to take care of prevention of complications. So we intelligently tailor them out for you. So don't have that bias that I'll take this or I'll take that. Thank you.
Right. Mr. Anas Ansari is asking, who should we consult, a general physician or an endocrinologist?
Well, I don't want to say that there are very good general physicians as well. There is nothing like that you should not see a general physician, only see an endocrinologist. In this context, I'll tell you that in UK, diabetes has gone largely to the primary care. What I mean is gone to the GPs, and because the numbers are so high, and some of the treatments are quite straightforward. And but of course, if you have a complicated diabetes or if you have diabetes that you think I want to go to an expert because it involves in lot of science now in terms of which tablet to use and how to prevent complication. So it will be your choice, but there are very good general physicians and of course experts who can help you. So make your choice. I'm sure that even the general physician, a good general physician, would look into your case, and if he thinks you are appropriate, he will refer you to a specialist. That should be the order of science.
Correct.
So you feel free. Doctors are there to help you. Thank you.
I hope that answered your question, Mr. Ansari. The next question is from Ms. Anjali Anand. Can a lean person having type 2 diabetes gain weight? I'm 25-year-old female having type 2 diabetes. I am losing my weight drastically. I don't want to lose weight, rather I want to gain weight. So please suggest.
First of all, that you can lose
Understood.
weight because of one, that suddenly what happens when the diagnosis of diabetes comes, you cut short your diet and you do a lot of exercise. That is one reason you start eating very less. In fact, when one patient came to me and I asked, I found that anything that comes on the table is thrown away by children, more or less. So that father or mother, you shouldn't take this, that. So suddenly your calorie requirement decreases a lot from what you were taking. So that causes weight loss. That is number one. Number two, there are some diabetic tablet which causes weight loss and that is desirable. So that is the second part of it. So we have to also see why you are losing weight. There may be clinical condition that is causing weight loss. That may be thyrotoxicosis or other things, malabsorption, malnutrition, whatever. So there may be many things, including simple as worm infestation. So we have to see that what is causing a loss of weight. So some diabetic tablets causes weight loss and that is for your benefit because they are actually beneficial for the patient. So we have to see your context, why you are losing weight, what has happened to your calorie
Right.
intake in contrast to your before, and then we have to decide that why you are losing weight. There is an independent medical reason for losing weight, and then we need to address it. Thank you.
Right. So the next question I have is from Mr. Sagar Sachdev. Greetings, sir. My HB1AC level rose from normal 5.2 to 11.8 in 3 months. I have not got COVID. What can be the reason for this sudden rise? I'm on medicine now and HB1AC is 7.1. It's been 3 months.
If I haven't got the whole picture, but to tell you something, our target is 7 as a blanket rule for HbA1c. We, of course, targeted to young active individuals at 6.5. Now, the point is, if you have gone up, so obviously we need to appropriate your diet, lifestyle, and medicines. So, if I can hear your precise question is, can you tell me the precise question he is asking me?
Sure, sure. So he's not got COVID and he rose from a normal HbA1c level 5.2 to 11.8 in 3 months. What could be the reason for this sudden rise? He's on medication now and his HbA1c is 7.1, but it's been 3 months now since his levels rose. And he's wondering why such a steep rise has happened.
As you know that the rise in blood sugar as manifold. Number one, it is a progressive disease. Diabetes is a progressive disease. So with time, your HbA1c will go up, and that's why we keep titrating our drugs to match that. Number two, it depends upon the lifestyle you are leading, and that includes your food. You may have unknowingly eating something that is causing your blood sugar to go up and you are thinking this is very beneficial. I've seen many patients who come to me and said, I'm taking this in excess for my health. I've read it in journals, and that is causing blood sugar to go up. So some people come and tell us that I don't take sugar, but I took jaggery, good. That is good for the health, and I take honey
Right.
that causes rise in blood sugar. So you have to identify that whether it is a progressive deterioration, then you have to see what the diet you are trying to take. So what we need to do is keep you on target, revise your prescription, and also take care of possible complication, and also give you the diabetes education. Remember, diabetes education and treatment is a two-way process. It is not instructive or prescriptive, it is consultative. We must tell you what is good for you, what is in what context. And then you should know many people have a bias. Like in this part of the world, a lot of people take some food that they don't know that this is causes blood sugar to go up. So there are many people like that in many
Right.
areas. In eastern India, you take a lot of rice. So there are a lot of in the south of India, you take also idlis and dosas, and there is a lot of people who take a lot of food which are refined carbohydrate, and they cause blood sugar to go up. So you need to sit with the doctor
Correct.
and discuss the drugs you are taking, the lifestyle you are having, the medicines you are taking, and then we come to a conclusion. But it is a manageable problem. Thank you very much.
Absolutely. Thank you so much, Doctor. Now, I'm going to leave the stage for you to give us your top tips, but I do want you to tell us what about your top tips to manage diabetes for youth, and tell me also about the warning signs that one needs to look out for, because I don't think that's something that we spoke about. So, do give us your top tips.
Well, my top tips would be first is that you should have a healthy lifestyle. What I'm trying to say is that you should have acceptable physical activity level. If you have got family with diabetes, your parents are diabetes, you should also from time to time check your blood sugar. Number three, if you are diabetic already, you should monitor your blood sugar and should see an expert to see that what is your blood sugar level doing. It is not just take it and shut it and forget it. It's about from time to time monitoring of the blood sugar. So you should monitor your blood sugar, you should consult an expert, and you should see that on the diet front you are on the healthier diet. You should have physical activity. You should always go to a doctor to make sure you haven't developed complications of diabetes. That is also very important, and we try to advise you about lifestyle, which is crucial to prevent diabetes. Remember, a lot of studies have been done to prevent diabetes. So it is very important that you don't become overweight, you have a healthy diet. And if you develop diabetes, my tips are that eat healthy, consult your doctor, take your medicines on time, and look out for your complications from a doctor consultation. And I'm sure that if you are trying to do this, diabetes is a manageable problem, and there is no reason why you should not remain healthy with diabetes. But regular consultation is very important. Somebody thinks it's like a cough and cold. You come and see a doctor, take your medicine, and do not see him for a year or 2 years. I think don't do that. Monitor your sugar, remain in touch with your doctor, and you'll have a perfect and healthy life with diabetes. Thank you.
Thank you so very much for joining us, Doctor. This was an absolutely insightful session. So many, many, many thanks to you, and we hope to see you soon again.
Thank you very much.
Well, guys, it's now time for the quiz, and I hope you guys are ready. Let me give you a tip. Some of these questions will be very easy to answer if you have the Apollo 24/7 app on your phone. It's very simple. You just have to answer the questions over the chat. The winners' names will be announced at the end of the show. Winners to mail their contact details at marketing@apollo247.com, and gift vouchers will be shared with you. Well, so here are the three questions. The first one, when is the World Diabetes Day? Again, when is the World Diabetes Day? Question number two, which organ in the human body produces insulin? Once again, which organ in the human body produces insulin? And question number three is, which premium membership plan of Apollo 24/7 provides you with benefits like free delivery of medicines and 24-hour emergency doctor on call? Once more, which premium membership plan of Apollo 24/7 provides you with benefits like free delivery of medicines and 24-hour emergency doctor on call? So go right ahead and type in your answers. Also, this festive season, Apollo 24/7 gives you a chance to get a flat 25% off on your first 3 online medicine orders. Isn't that wonderful? So do not stop at once. Save thrice with the coupon code FIRST3 or FIRST3. Order now on Apollo 24/7 app and the website. Before we move on to announcing our winners, I have a very special message for all of our viewers. We're well into our festive season, and this year, finally, there is happiness and positivity all around us. But let's not forget, it's only because of the hard work and the sacrifices of our frontline workers that we are where we are today. We've put together a little something to show our gratitude to our heroes, and we hope that they too get to celebrate festivals with their loved ones this time. Please find the link to watch it in the description box below. For every share on the video, Apollo 24/7 will contribute ₹100 to Saving a Child's Health Foundation. So let's come together and do our little bit for this good cause. In case you have any, so can we have the audio visual, please, guys?
Surprise! इस बार मैं भी
मम्मा मम्मा पापा
इस बार मैं भी ईद मुबारक भाई।
इस बार मैं भी
इस बार मैं भी
इस बार मैं भी
इस बार हर कोई मनाएगा त्योहारों की खुशियां अपनों के साथ। पिछले 2 साल से हमारे फ्रंटलाइन वर्कर्स की बदौलत ये मुमकिन हो पाया है कि हम सब अपनों के साथ हर त्योहार की खुशी बांट सके। इस बार हम आशा करते हैं कि वो भी त्योहारों की हर खुशी अपनों के साथ मना सके।
And after that beautiful film, I just want to tell you that in case you have any questions about your health concerns, you can use the special coupon code HH247 to get rupees 199 off on your online consultation and 15% off on medicine orders placed on Apollo 24/7 app. And now for the big moment. The winners of today's quiz contest are Dheeraj Sharma, Sagar Sachdev, and Prasad J. Congratulations to our winners, and thank you every one of you for joining us today and participating. And hope you found the information shared useful and would follow the amazing tips shared by our doctor. We'd like to say goodbye here, and we'll be back with another important topic and an Apollo expert next Sunday at 11 a.m. So stay tuned and keep wearing that mask to stay safe. Goodbye and God bless.